Thank you. Hi everyone, and welcome to the fourth session of our 2026 Global Collaborative Series, Global Nursing Force, Bridging Health and Climate Action. My name is Olivia Halibicki, and I'm an assistant professor at the University of Michigan School of Nursing, which is organizing today's session series, along with Vanderbilt University School of Nursing and Yale School of Nursing. This monthly event is made possible through really generous collaborations of our esteemed partner host, which includes Dr. Gianni Marie Steccarini, who is a professor and associate dean for global affairs and director of the Pan American Health Organization of the World Health Organization Collaborating Center at the University of Michigan School of Nursing. And she works alongside Dr. April Capu, who is here, and a professor and associate dean of strategic partnership and global affairs at Vanderbilt University School of Nursing, as well as Dr. Asia Newpain, who is the Director of Global Affairs and Planetary Health at Yale School of Nursing, and Betsy Usher, who is the Assistant Dean for Alumni and Career Services at Vanderbilt School of Nursing. Thank you to all of our partners and their dedication and contributions to this initiative. Each month, we take turns hosting this important series, and we encourage everyone to stay engaged by registering for future sessions, which I'll tell you about at the end of our event today. So now it is my pleasure to introduce today's speaker, Sharon Oyelayu, who is the Executive Director of EcoHealth Africa. Sharon currently practices with the Lagos State Health Service Commission in Nigeria. Her clinical expertise provides her with firsthand insight into how environmental factors, including pollution and changing weather patterns, directly impact patient outcomes and the spread of infectious diseases. She serves as the executive director of Eco Health Africa, which she'll tell us about today, which is a youth led organization empowering healthcare professionals to effectively educate marginalized communities on climate health. Her advocacy is backed by a robust academic foundation featuring certifications from the United Nations Institute for Training and Research, and Columbia University's Global Consortium on Climate and Health Education. So please welcome me and giving her a really warm welcome as she shares her expertise with us today in climate change and health and empowering action through EcoHealth Africa. And Sharon, I will turn it over to you to share your slides.
Thank you so much, Professor Olivia. Good morning, good afternoon, and good evening from wherever you're joining us. Permit me to share my slides. All right. Can you confirm if you can see my slides?
I think they're still just loading right now, so let's give them a second.
All right.
There we go.
Awesome. Thank you so much. Good morning, good afternoon, everyone, once again, from wherever you're joining us from. I am Sharon Oyelayo, the Executive Director of EcoHealth Africa, and I'll be speaking on climate change and health, empowering action through EcoHealth Africa. But before I proceed, I'd like to appreciate the University of Michigan School of Nursing for this beautiful platform in collaboration with Yale University School of Nursing and Vanderbilt University School of Nursing. All right. So this is my story. In the first picture, you can see a boy in a yellow bus, and the other picture is the effect of flooding. So let me start. As a young girl who was, born in Nigeria, born in Lagos and bred in Lagos, I've seen firsthand what climate change can do to human health. I've seen different issues that climate change has affected, different things that climate change has, done and impacted to the community. So this bus is the popular public mode of transportation in Lagos. We call it Danfo, DANFO. And just like this bus, this boy sits at, the corner of the window in this bus. I was seated in this same position in this bus some years ago. And the person who sat beside me gave me an empty bottle of plastic bottle of maybe soda. I think it was soda. Yes, he gave me an empty plastic bottle. And he made a request. He said, I should please kindly help me discard this through the window. And I was wondering, you want me to discard this bottle through the window? Okay, I collected the bottle. I didn't throw it out. What I did was I asked him a question. Sorry, excuse me, sir. Do you know that this bottle can cause the loss of lives? Do you know this bottle has the capacity to kill so many people? And he was wondering, trying to connect the dots, trying to think of the context where I was coming from, why I tried to ask that question. And he said no. Then I explained how plastic bottles, how plastics can get clogged up in the drainage system. Then rain falls, leading to flooding, displacement of people, loss of properties, loss of lives, and everything like that. I didn't know it had an effect on human health as at then. I only knew the general point of view. I only knew the general things flooding would cause. So this second picture is a picture I took with my phone in 2024, June 2024, after a heavy rainfall. I was on my way in my community. I was on my way out, and I took this picture. The flooding that happened and occurred in June 2024 claimed lives, claimed properties, caused a lot of people to migrate from one place to the other. And in July 2024, the following month, Lagos recorded about 1,500 suspected cases of cholera that particular year, that particular month in July. So because the rainfall did not just fall, rain didn't fall just for a particular day, it was that season. And the following month in Nigeria, in about 35 states in Nigeria, Nigeria recorded about 4,800 suspected cases of cholera, with about 150 deaths from this same flooding. So all of these things built my curiosity. All of these things, built made me more inquisitive about what climate change is, about how climate change impacts human health. As a matter of fact, in school we took a course on environmental health, and in that course we talked about, I think, the introductory part of the course, our lecturer taught us on the emerging issues affecting environmental health. And the first emerging issue was climate change. Yes, there was disaster preparedness. Yes, there was nanotechnology. But the first issue was climate change. All of these things, created and birthed the vision of EcoHealth Africa in my heart, because it seems to me that climate change is a big deal. It seems to me that climate change impact on human health is really a big deal, and it's something we need to talk about. It's not something we need to just shade off. It's not something we need to just shut our eyes to. Yes, this first picture, this was a project, a cleanup project at Eco Market. Eco Market is a market situated on Lagos Island here in Lagos, Nigeria. And it was a collaboration with Global Shapers organization, Lagos Hub. We went to the market, we spoke to the stakeholders, we volunteered, yes, and we volunteered to clean up the market. This was after the cleanup. The second picture was the medical outreach that was organized, and we had health education for the people in the community. You see children in the picture, you see adults in the picture. We had health education for them. They saw doctors, yes, and they also had the opportunities to meet pharmacists who prescribed the right medications for them that they needed. Yes, this was me representing EcoHealth Africa at a panel discussion with Lagos State representatives from Lagos State Waste Management Authority and the pharmacists, talking about the intersection of climate change and antimicrobial resistance. Intersection of climate change and antimicrobial resistance at the One Health Summit. The second picture shows me talking to nurses it was at the nurses conference, by the way, and we had a session on climate health and nursing. What intersection? How do we merge both together? What's the nexus between climate change and human health in relation to nursing? And now this is a pie chart, and this pie chart talks about the effect of climate change on human health in Africa. You can see from the pie charts that waterborne diseases carries a larger percentage, which is about 40%, 40%, and all of these things stem from flooding and extreme weather that occurs in communities. This is exactly an exact reality for communities in Africa, where access to clean water is not guaranteed. So people come down with waterborne diseases, people come down with cholera, people come down with gastrointestinal tract conditions and infections. Then we have vector-borne diseases, which accounts for 28%. And we see this play out in rising malaria cases. Yes, rising malaria cases as a result of changing weather patterns. Mosquitoes have the capacity to breed and thrive in certain environments that have mosquitoes thrive in certain environments as a result of flooding and extreme weather patterns in that community. Then malnutrition and food insecurity. Families struggle, famine, because they cannot predict the produce that they get from farming. So food insecurity stems in, malnutrition stems in, and we have other health impacts such as health, heat stress, respiratory conditions, which accounts for 12% on this chart. All of these things do not just reflect communities, doesn't just reflect climate change, but this chart reflects people, it reflects the needs of people in African communities. And that is why EcoHealth Africa has come to bridge that gap in climate change and health. Now about the organization, EcoHealth Africa. We are basically an interdisciplinary organization, and we are an interdisciplinary organization that is dedicated to addressing the growing intersection between climate change and human health. It's basically just a room where climate meets with health. We're a growing community of professionals. We have veterinary medical students in our team. On our team, we have nursing professionals on our team that is dedicated to promoting climate health education among marginalized communities in Africa through innovative solutions, through sustainable practices. Yes, about EcoHealth Africa, we're spotlighted by a journal. This is an article by a journalist on social media, and this just basically talks about what we do, what we've been doing all this while, and we're really glad that we got this spotlight. You can scan the barcode to read through the article. Okay, this was EcoHealth Africa speaking at the climate workshop in 2024, Alimosho Climate Workshop in 2024. Alimosho is a local government in Lagos, Nigeria, and we're told to speak to market women, we're told to speak to school children. They were all invited for the climate workshop, and we're surprised at certain questions that people asked, especially the market women. They asked questions like, why are the food prices high? How do they clean and clear up their environment, especially during flooding? How do they do all of these things? And one thing that struck me, one thing that was really intriguing for me was the act of the children. Children have a way of learning and picking things very, very fast. To my surprise, I think they gave them some sweets, some wrappers of sweets in a disposable plate. Yes, each table, that's how it was arranged that particular day. And some of them already took sweet out of their wrappers, and the wrappers was littered on the table. They were littered on the table. So after speaking, I could see them basically return the wrappers back into the disposable plate. And I was amazed. That's how much children learn. That's how much they make things habits. Yes, that's how much they make things habitual, and they attach it to their everyday life. So that was what we came here to do at this workshop that particular day. Then, what are the role of nurses in climate action? What are the role of nurses in climate action? Nurses play a significant role in climate action. Number one, they are uniquely positioned to nurses, to patients. They are uniquely positioned to patients. They educate patients, advocate for healthier environment, and also lead grassroots climate action. We all know that nurses stay with patients long enough compared to other medical practitioners, other medical professionals. So that is basically like our value proposition, and then what we can do to bring that information, to bring that health education even to patients in education, advocacy, and also leading grassroots climate action. And we carry out certain projects in EcoHealth Africa, such as research, yes, which helps to drive evidence-based solutions that connect healthcare and climate action to empower communities and also inspire change. As a matter of fact, currently we're carrying out a research in collaboration with an organization to assess the knowledge of healthcare professionals in climate health education. Not all healthcare professionals have this knowledge of climate health education, and we need to really assess so we know what next to do, especially in hospitals and in places where healthcare professionals would work. Healthcare professionals, same. Next is school outreaches. School outreaches. Basically, just like I said earlier, children learn fast. Children take things to heart. Children learn fast, and whatever thing they learn is what takes them through, even through their adulthood stage. That's one. That's one of the reasons why school outreaches is one of our projects. So we help to empower young children with climate health education by inspiring awareness, inspiring resilience, and also sustainable practices for a healthier future. Next is community engagement. Community engagement. We help to strengthen marginalized groups through climate health advocacy, just like I explained earlier, and we also collaborate. The climate communication workshop I talked about earlier, we had collaborations with Lagos State waste management authorities and also sanitary inspectors, because in Lagos, Nigeria, we have something we call sanitary inspectors, although it's not in English. We don't pronounce it in English. We pronounce it in Yoruba language. That's the way people know it to be. So those sanitary inspectors, what do? They have a particular day where they go to each street, each community to be sure that they are actually carrying out proper environmental sanitation. All of these things is for their human health. All of these things is for them to thrive and also improve their well-being. Now, what next at EcoHealth Africa? We are open to collaborations. We are open to partnerships that support our vision, partnerships that are in line with our mission, and that can also bring solutions to the climate health impact on human health, climate health impact on humans. So we're open to anything, especially things in line with our vision and mission. I don't know if you have questions and answers for me at this point to answer them. Thank you very much. Professor Olivia, over to you.
Yes, thank you so much, Sharon. I think I'll let everybody muddle for a minute and I'll ask you a question. I'm really interested in how, you talked about like what your personal experiences were with climate health and how that's influencing people's health and why you wanted to start EcoHealth Africa, but I'm really interested in like how you got that started. Did you come to some of your coworkers who were healthcare professionals or friends, or like how did it get started that you said, okay, we're going to create this organization that's going to have all of these arms of research and school outreach and community engagement? I'm really interested more in like the origin of how it got started.
All right. Thank you so much for that question, Professor Olivia. Firstly, I know that you cannot run a vision alone. No man can run a vision alone. So practically, I found people who were also carrying that same vision at heart, people who were also burning with that same mind of vision. and together we're able to start something. Yes, it was not easy when we started because it was looking like nobody has done this before. Nobody has put all of this together, especially in this part of the world before. So it looks very abstract. It looks very, it looks overboard. It looks very abstract. And one of the things that we're able to do was trainings, because climate science is a different thing on its own. Climate science, climate change is a different ball game on its own. So we're able to go for trainings on climate communication, trainings on climate science, and how to bring this into human health, how to bring that intersection and nexus together. I don't know if that answers your question.
Yeah, it definitely does. And I'll echo Jennifer put in the chat saying it's amazing. I love the inclusion of the children. Teaching them to respect the environment at a young age will help further your work. And that was what I was going to follow up to ask with you of, this is a youth-led organization, which I think is something incredibly unique for youth to care about environmental health and climate change, but to also spend their time working on these things. So, like when you go to community engagements or to schools, is it you who's going? Like, who else is a part of your team that helps support those projects?
All right. Thank you so much. I think some of my team members are on this call. I saw them join the call earlier. Yes, some of my team members on this call. Hadi doing is on this call. She's our community manager. She manages our community. Let me see. Promise is also on this call. Yes, and a few other people. I may not be able to pick their names right now at the moment. But we have veterinary medical students who assist in with the work. We also have nursing professionals on our team who assist with the work. Okay.
Go ahead, Erica.
I was wondering, I don't know what it's like in Nigeria or other countries, but here in the US, we get a lot of kind of pushback on science. When you're teaching the kids or doing community outreach, have you run into people who just basically refuse to believe in climate change? And if so, like, how do you, like, do you have any good strategies to help? Educate people about like the reality of climate change, or like how have you handled that?
All right, thank you so much for that question, Erica. Yes, in fact, there are different approaches to teaching people about climate science. People react differently to what climate change is. Some people don't believe climate change exists. Some people think it's just scientific thing out there that they don't need to be involved with. They don't even think that the activities could have an effect on climate change. I mean, human activities, burning for fossil fuels and the likes. So one strategy we do, one of the things that we do is to read the room. We know the kind of people that we are speaking to because not all communities are the same. What's significant to community A might not be significant to community B. What's significant to a class of secondary school students, maybe junior secondary school students. I don't know the way it's structured in the US, but here in Nigeria, we have junior secondary school, we have senior secondary school, then tertiary institution. So what is significant or pertinent to junior secondary school students might not be the same with senior secondary school students. It might not also be the same with tertiary institution students. So one of the things we do is to read the room. When we see the kind of people we are dealing with, we know the approach to bring to it. So we also have like a document on what would naturally teach everyone about climate science in any at any program. And another thing we do is a pre-test and a post-test format. So we test their knowledge on climate science, climate change before the commencement of the program. After the commencement of the program, we share sort of like a questionnaire post-test to know if they are truly involved in what, if they were truly involved in what we taught them, or if they truly believe in what climate change can do to human health. I don't know if that answers your question, Erica.
Yeah, thank you. That was great.
Awesome.
April?
Hi, yes, that was very good. I really appreciated your presentation. So I have a question. If I'm speaking to a group of youth today, what, and well, I guess I'm asking you, if you were speaking to a group of youth today, what would be three things if they were going to get started and they wanted to get started and they wanted to do something that would be impactful today? What would, and I'm sure you have these types of conversations quite often. What would be three things that they could do right away to make an impact, to make a difference?
All right. Thank you so much for that question, April. Like I said earlier, all communities have their own significant, issues. So if we discover that a particular community, one thing pertinent to this community is improper waste management, for example, we try to ensure that they either build groups in their communities that would help to manage, and of course with collaboration with the right stakeholders. They build communities together, they build groups in that communities that would help to curb their waste management. We can also speak to, we also would also speak to the relevant stakeholders to maybe provide waste bin in that community. The youth, they can come together, they could have a campaign, they could have a climate change walk in that community. It's also something that helps to raise awareness, something that helps to inspire awareness about climate change. They could get waste bins, like I said, in that facility, in that community rather. They could also, they could also build innovative solutions. One thing that I see youth do nowadays, although we've not had the opportunity to do something like that yet, is turning waste to wealth. So a lot of youth nowadays, they come together, especially in communities where they are aware of climate change and its impacts. They come together, they create waste out of wealth. A beautiful example is Semilade Salami, who creates waste denim, creates denim into materials such as bags, such as sandals. So there are people who create things like that into artworks. So it depends on the community, it depends on their interest, it depends on what you've been able to notice when speaking to them. Some of them ask certain questions, and from the questions, you can decipher that, okay, I think this is what this community will need. I don't know if that answers your question.
That was great. Thank you so much. All great suggestions. Thank you.
My pleasure.
Sharon, I have another question for you that's a little slightly changing topic. And just a reminder for anybody, if you do have a question, raise your hand and I'll jump to you afterwards. But you had mentioned, Sharon, that when you were in school, you actually had a class that focused on, I think you phrased it as like environmental health or environmental science. And I'm assuming that's when you were in like school looking at like healthcare and nursing, and that feels, at least to me, really unique. I don't know how other people feel on the call, but when I was training to be a nurse, that is not a topic area that I was educated in. I don't know if other people feel similarly, but I'm really interested, Sharon, of what else was covered in that course, and is that something that is common in programs in the area, or was that really unique that you got to experience?
Okay, thank you so much for that question. For me, it was unique because I think in certain communities outside Africa, they teach young children as young as age 2. They teach them about climate change, and I didn't get to experience that. So I only met something like that when I got to while studying doing my degree. I'm not done yet, by the way. So um, I only got to hear of that while studying for my degree in environmental health, and it was practically and it was practically about the environment, not exactly human health. So you'd see things in that course talking about toxicity, toxicology, epidemiology, environmental epidemiology, and some other things. So, but there was a part that struck me, and I think that was where everything, just started for me. Emerging issues in environmental health. I was surprised. Why was climate change the first emerging issue in environmental health? All of these things made me go for courses, made me attend trainings to really, really know more about how it intersects with human health. I don't know if that answers your question.
No, it absolutely does. I think something that I think a lot about is like we would call them like undergraduate nurses getting their degrees, and they're so excited to learn like hands-on skills like how to start an IV or give medication and things like that. But there are so many things that nurses can have an impact in, and I think it's great that you were able to have a course to start thinking about environmental science, environmental health, climate change. It's something I wish that I would have learned about earlier, and I'm constantly thinking about how we can bring that to the forefront of education for nurses. I should say Sharon is a student in doing all of this work, so I don't know what you all were doing as students, but I wasn't starting an organization, so it's very, very impressive to see that come to life. Is there anybody else that
Thank
has,
you so much,
of course,
Professor
Sharon.
Olivia.
Anybody else that has questions for Sharon about her experiences, EcoHealth Africa? It is Earth Day. Happy Earth Day to everyone. Well, Sharon, I know that you said that you are also looking for um, collaborators. I was wondering if, um, well, I guess I'll hold my question as I just saw one from Caroline in the chat. Caroline says, wonderful presentation in this era of measuring outcomes. Um, and Caroline, could you define ROI for me just so I make sure I know that I'm on the same page as you? Return on investment. Thank you. So in an area of measuring outcomes and return on investment, how are you doing that? And I think maybe Sharon, that speaks to some of the um, research that you're doing, but also the commitment that you have to doing these community engagement sessions and works with schools and thinking about um, like how much money is being spent on things and how much time it's taking you and what that return on investment is. Does that question make sense?
Yes, it does. Thank you so much for that, Caroline. Firstly, EcoHealth Africa is a non-governmental organization. We are non-profit, and we are not making any money out of everything we are doing. So yes, it's time consuming, but we try to have a structure. One thing we do is we're a growing organization, by the way. Professor Olivia heard that earlier. We're a growing organization and we've not gotten anywhere yet. We're just starting out. So one of the things that we've done so far, or one of the things that strategies we've been able to employ is creating a calendar for our year. So we know that this year we are just going to focus on 3 projects. We're going to focus on 3 projects. And one way in which this can be possible, or one way in which this is usually possible, is collaboration with other organizations who have been in the field longer than we have. So organizations who already have the resources, organizations who already have some of these things. It's not just EcoHealth Africa doing everything. We're a growing organization, but we make use of collaboration, we make use of partnerships, very, very key. I don't know if that answers your question, Caroline.
Yes. I think that was you're kind of getting into the question that I had for you, Sharon, is like you said, open to collaborators. So obviously for
Yeah.
supporting the organization of itself, are you interested in collaborators for more like speaking engagements, for research? Like what other areas are you looking for? I think this is a great team to be able to like put out that message of what it is that you all are looking for in collaborations. And even if it's not somebody on this call, maybe they know somebody else. So like I want to give you a platform to be able to ask for what it is that you all are looking for next.
Yeah, thank you so much for that, Professor Olivia. We are looking at collaborating and partnering with people or organizations who can give research grants, can also give grants, because organizations can request for grants. There's the research grants separately and those grants separately. So organizations they actually give out, some international organizations or non-profit organizations give out grants for small and growing organizations like ECHO Africa. So we're open to that. We're open to research grants. We're open to collaborate. We're open to helping to help educate a community, that's speaking engagement. We're open to certain hands-on projects in particular, not just speaking engagement, but hands-on projects. So anything that aligns with our vision, anything that aligns with our mission, we are really open to doing that. Thank you so much.
I wonder, Sharon, if you could put a link to the website page in the chat and maybe your email address too, so that people can save that if they wanted to reach out to you. And I'll pause for a moment to see if anybody else has any questions for Sharon. And I guess I'll take this moment to remind everybody of our next session next month, which will be on Wednesday, May 27th at the same time as today, so 9 a.m. Eastern Standard Time. You may need to re-register in that Zoom link because you pick individual days, so just check to see if you have registered for next month if you plan on attending. And I think that Jen, there you go, Jen will put it in the chat for you all too. And then thank you, Sharon, for sharing your email address as well.
It's my pleasure.
Well, I can give a final thank you to you, Sharon. This is incredibly impressive, and I think April put that in the chat as well of you are doing such amazing and impactful work. It is incredible to have somebody so youthful excited about this area, and it definitely invigorates me and makes me think about how we can be integrating environmental health and climate health into our youth through education and through community engagement as well. So thank you everyone for joining us today, and we hope to see you next month. Thank you, Sharon.
Thank you.
Thank you, everyone.